For my microorganisms from a Christian worldview, I chose AIDS or acquired immunodeficiency syndrome. I chose verse Galatians 6:2. Carry each other's burdens, and in this way you will fulfill the law of Christ. I chose this verse because I see it promoting open-mindedness and supporting each other, especially through times of difficulty. The signs and symptoms for AIDS can be broken down into 3 categories: acute, symptomatic, and progression. For acute, these are usually flu-like symptoms and occur within the first 2 to 4 weeks and include fever, headache, muscle pain, sore throat, mouth sores, swollen lymph nodes, and diarrhea. As HIV progresses, infected people may get mild or long-term symptoms, which include oral yeast infections, also known as thrush, shingles, also known as herpes zoster, pneumonia, fever, fatigue, swollen lymph nodes, and diarrhea. As we know, AIDS is the advanced stage of HIV infection where the immune system is severely damaged, and most symptoms usually come from the body's inability to fight off the pathogens, and opportunistic infections in certain cancers often indicate progression to AIDS. And the signs and symptoms usually include skin rashes or bumps, rapid weight loss, and constant fever, swollen lymph nodes, fatigue, white lesions on the tongue or in the mouth. Causative agent for AIDS is caused by human immunodeficiency virus. It's a retrovirus in the lentivirus genus. It's an envelope virus with a capsid of 2 RNA strands and is generated by reverse transcription of the viral RNA genome into DNA. It targets CD4 plus T cells, macrophages, and dendritic cells, and is surfaced with glycoproteins GP120 and GP41 for host cell entry. HIV typically enters the body through mucosal membranes or bloodstream, often via unprotected sex, sharing needles, or childbirth. HIV requires both CD4 receptors and chemokine receptors to infect the target cells. The 2 major co-receptors, CCR5 and CXCR4, target T cells and macrophage cells, with the CCR5 targeting the T cells and the CXCR4 targeting the macrophage cells. Viral RNA converts into DNA via reverse transcriptase. The viral DNA integrates into the host genome. Then comes the cell destruction of the CD4 plus cells, which then cause the immune system to collapse. After all, this will lead to AIDS when the CD4 count is low in the presence of opportunistic infections. In 2024, 40.8 million people were living with HIV globally. There were 44.1 million deaths from AIDS-linked illnesses since the beginning of the AIDS epidemic, with 53% of those living with HIV were identified as female. There are also statistics showing how AIDS-linked illnesses have decreased by 70% since 2004 and 54% since 2010. So there is no current cure for AIDS. Antiretroviral therapy, also known as ART, is a pill or injection that suppresses the viral load in the body. There are also many prevention methods, such as using condoms for every sexual occurrence, using sterile needles when injecting drugs and not sharing the needles, and receiving treatment during pregnancy to decrease the baby's chances of receiving HIV from the mother. When we approach HIV/AIDS prevention and treatment through a Christian worldview lens, we recognize that the responsibility believers have to take care for those who are sick and vulnerable. God teaches us to show compassion and serve those who suffer rather than judge them. This means spreading awareness, reducing stigma, encouraging safer health practices, and overall helping prevents more breakouts.